I'm Shauna Richardson. I work at Kit Carson County Health Service District in Burlington, Colorado. I'm the compliance officer and also the specialty services manager and in charge of recruitment. We're a rural facility. We're a 19-bed hospital, and we're in a COVID crisis.
Oh, well, tell me a little bit more, Shauna, about your COVID crisis.
So with COVID has been a big lesson for us. The biggest thing that I can see from a rural perspective is, thank goodness it hasn't hit hard out here yet, but we have encountered delays. We have had to use the national surge for some stuff. The biggest thing is trying to get all of your employees. I have 16 employees, and trying to get them managed, understanding that the potential for them to be furloughed or laid off, trying to use resources, trying to manage all different things in a different perspective. Run an incident command has been very difficult. It's really worked well, though. Our facility's done very well. Also, if we do encounter a surge, I feel that our hospital is very well staffed, and we have the foresight to see on our PPE. We aren't running really short right now. We did have some issues with some extra large gowns and Tyvek suits. The community's been very good about donating things to us, so that's went very well. We somewhat had a setback. As y'all know, rural facilities have a difficult time right now as far as financial end of it. So adding COVID on top of it's been a real challenge. We have been doing a lot of grants, trying to get grants written, apply for SBA, then they run out of money. So we're still keeping our fingers crossed there. Today is day one of starting our furloughs for our employees. So that breaks my heart because I care so much about my employees. That's probably been the biggest thing, is how much I care about my employees and what's going to happen to them and how they're getting along. That's been very hard. We've got some staff working from home. I work from home as much as I can, except for when I need to be in here. So that's been a great challenge to me, to have to try to work from home and manage everything that goes on at home. And with your work life, I probably work more now at home than what I do at work, because you can't be here at 2 o'clock in the morning or 4 o'clock in the morning. But I think we're going to carry some big things out of this. I mean, I don't know if norm will ever go back to norm. We're busy right now in trying to get phase 1 implemented. We're just trying to see what all is going to happen. We've already got our policies drafted for phase 1 for our COVID patients. If we'd happen to have a COVID patient, we do OBs out here. So we have to be ready in case we do have a COVID positive OB. Of all things, May is our big OB month this month. So this is going to be a challenge. But I think we've got everything set. We've got our policies in place. We've been blessed with a great infection preventionist who's all over this. So it's really helped a lot. Probably the lacking piece of rural is we don't practice emergency preparedness like we all should. I think everybody in the rural areas is really realizing how important it is to run your drills, go ahead and do your decontam, the whole 9 yards. That's been very challenging. We've had a few other challenges at an administrative level, so that's made things just a little more difficult. Then on top of that, we had a physician that went out, so now our community's down a physician. And then we have a planned exit that a physician is resigning in the end of July. We've known that for a while. So that'll take us down to 2 physicians. So we're hoping that we can get somebody recruited to fulfill that. We're working on trying to fulfill the other gap with the other physician. So we have some great challenges. It's been challenging to say the least, but we've made it. I'm really proud of our facility and the staff that's in it, how well everybody's pulled together, everybody's willing to do everything, and how well prepared we are for if we do have a COVID surge. So it's going to be interesting.
So how long have you been working in this facility?
I have been at the facility for 29 years. This is the first time I've went through this type of crisis and been in a non-clinical area. Usually I'm frontline clinical. And so this has been a real challenge to be on the paperwork end and the balance and check end. I'm not sure. I think it's easier to be on the clinical side. There's times I really want to jump in.
I've talked to several other clinicians who are people who have been clinicians in the past and are in administration, and there's a lot of guilt out there. Are you feeling any of that?
Yes, I feel very guilty. I feel very sad. I don't know. I'd love to go to New York and help. I would love to be able to do that. I even wouldn't mind going to Denver and helping, but I know I can't. I know, yeah, but you're guilty because I got my workers down there. I know and how hard they're working, what all they got to do to just see a patient, the risk they take home to their family. And here I sit in an office, shuffling papers, doing everything, filing things, managing it from a policy perspective. It just don't feel right. The other thing is the sadness that I feel for, we're a little bit not as restrictive as what they are at other places. I know it's coming, but for patients who are very, very sick and to not have all your family there and everybody around you, that would just be really, really sad to me. So far, we haven't had to encounter that. I'm sure it's coming, but we haven't had to encounter that yet. But yeah, I have a lot of guilt for all those people down there working and when I was in that working position, called them all a bunch of paper pushers. Now I'm one of them. That makes you feel really guilty.
So you shared that explain this to people.
I'm sorry.
Explain this. You're furloughing some staff members, but you're critically short for MDs. What's going on with that? Is that normal or is that COVID related?
No, one of them is an unexpected out. The other one is a planned retirement, going away. They're not retiring, they're moving on to another facility. So that was already planned. It's just when COVID hit, we still had 3 physicians at that time without that other physician. So we felt we were going to be okay because we also do have 3 nurse practitioners and a PA. The thing with our furlough is we've shut down the operating room department. We've shut down our specialty clinics. So that's really shut down our influx of patients. We aren't doing our outpatients. So we don't have, number one, like I said, with rural facilities, we don't have the revenue to support. We have no incoming revenue. So we are somewhat excited in phase 1, but yet I know I got to get on board to support the phase 1. I'm not sure that I know I will, but I just got to get a good understanding of it. The biggest thing of all is our infection preventionist is really on board. I think we've got everything in place to keep all of our patients in our facility covered so that we can keep them safe and protected. It's a hard concept for me to believe that there's not a waiting room that I can go around and laugh and talk to people. It's now our waiting room will now be your vehicle. I just have a hard time getting a grasp around that when I've been in healthcare 29 years with a waiting room. So to try to get patients educated, that's probably my biggest thing right now that I'm having issues with, is getting getting all of my patients educated, knowing that I'm going to have limited staff because of the furloughs. The neat thing is we've had an opportunity to look at the furloughs and try to keep the clinical people on, knowing that there was a potential for phase one. And then we're doing evaluations with our furloughs every 2 weeks. So that's going to be great, that we can reevaluate it at 2 weeks. And if we need to bring them back in, we can. And it also helps us to better plan for the implementation of phase one. So it's going to be challenging, and it's going to be very in depth with our education of how we educate our patients for their vehicles now, their waiting room and not our waiting room. It's also going to be a challenge for our physicians that come in from Denver, because they're going to have to wear certain PPE to be able to see the patients. The patients are going to have on PPE. We've evaluated all this in our PPE stock, and so far, since we don't have a big surge in our COVID patients here, we feel that we will not be running ourselves short to be able to open this up. I think about all rural healthcare facilities are going to have to do this to be able to survive. It's been a tough road for all rural healthcare, and now it's just a little bit more challenging. But I think we're all going to pull together and we'll all work as a group. It's no longer going to be a competitive market. I think that we're all coming together and going to utilize our resources among each other. So I think that's a positive thing.
So at a small facility, you have limited staff. What's the plan? Whether you have a surge or not, if you have staff exposed, what does that do for your workforce and those who are able to self-quarantine? And how does that work in rural communities?
Very challenging. We do have limited staff. Early on, we reached out to nurses out in our community who would be willing to work. We also have had certain people work from home so that we have a resource of nurses there. So I think for the most part, I mean, how do you know if you're covered or not? You don't. It's going to be a challenge, but I think for the most part, we've tried to do that weigh and balance. We've actually started this process on March the 17th. We started reduction of hours. We had some people out. And then April 1st, we actually started sending what we called as non-essential staff, which I don't like that word, but basically we kept our nurses and we've kept limited nurses. We also have nurses that are not working now who have opted to be called off so that like my surgery crew can come down there and work the floor. That way they're not in the mix of it, so when we need them. So I think we've done a really good job of weighing and balancing our resources, but you never know until you get into that situation. But right now, I think that's our plan, is how we've strategized with our staff. And we have a lot of, like in my department alone, I've got 4 PRN RNs that work in the specialty clinic, and I've got 3 PRN RNs that work in the surgery department. So that's a nice resource for us to also be able to pull from, let alone the other nurses that we've tried to recruit from the community who would be willing to come back in.
What do you think you're going to learn from this experience, both positively and things you didn't want to know?
I think that we as rural facilities, in my perspective, I'm going to learn a lot about how to be better prepared in things that they talk about that you think would never happen. You start running drills for them, you start preparing for them, you do training every time you get new staffing. My big push is to get them through. It's going to be mandatory that they take some ICS training. It's going to teach me that all the positions, maybe people are better utilized in different positions than what they're in. I think it's going to give us some great resources for positions we can open, how we can better utilize staff. I'm just not sure right now what all I'm going to learn from COVID. Right now, I have mixed emotions. I spend probably about 4.5 hours a day on paperwork alone just for COVID so that we can get reimbursed. It's very challenging. It changes CDC regulations, CDPHE, the governor, everybody's regulations changes so frequently. You just get a policy approved and passed and implemented and all the staff taught, and it's time to change it again. I think there needs to be a system for that. Instead of all of us people joining together, I'd like to see our consortium maybe work together as a group, that we have a policy resource that we can all share from. Maybe each facility drafts a policy that we can work off of, because the hours that are spent, that I spend alone just in policies, compliance, reading regulations, I think we could simplify it among this consortium. It just an event like this, I had no idea the paperwork it takes, and you have to do it or you won't be reimbursed, and you have to do it to get paid. It's a challenge. I had no concept. I'm just not sure I like the paper end of this. I think I'd rather be the frontline people. It's definitely different.
What's your facility doing to help maintain that behavioral health status of workers and keeping everybody as positive? Do you guys have programs that you're doing, or is that something that individuals are doing?
We are very blessed to have a social worker in-house. She has been extremely proactive in getting out to her employees. She makes daily rounds with her employees, just visiting with them, letting them know she's here. She's done a multitude of consults with her staff. Managers themselves are very, very well communicated with, so that they know how to talk to their staff, tell their staff. We try to, and that's the reason I was late for this right here, is because I was trying to inform my staff about the furloughs and making them feel, what to expect, questions to ask, things to do, how to go about it. So I think we've all been pretty well versed in trying to keep the staff up to date. I've not seen any real major issues. I think the deal with our social worker going around has been a great asset and has resolved a lot of issues that may come about. So I think we've handled that very well. I mean, like I said, I knock on wood, but I think our facility as a whole has been very, very well prepared. And I think it's just because we've had time to. We didn't start in a COVID crisis. We've had a workup to get to our very first COVID patient that we had. So I think that helped us a lot, be ready and get everybody prepared. And so I think for the most part, we're doing really well with that. I've not seen any major issues, major meltdowns. As managers, we group together as managers. Not all of us have good days. Matter of fact, I had a very bad day yesterday. It was great to support people that I had, to be around me, to just give me reassurance of, we'll get through this. We're going to keep going. And I think that's what helps us, for us people that are here. We just kind of group together, and it's great. I mean, it's our own little family we have among us, so it works very well.
How about the community? Is the community reaching out to be supportive of what's going on at the hospital? And if so, what does that look like?
As far as the community, we haven't put a big call out for anything. They're very supportive in, what we've done. Matter of fact, we had a group, I think it was a quilters group, don't quote me, but a group of ladies who actually went to town when we were asking for masks, and have made tremendous, beautiful masks. supplied them to us, has been there for us. Like I said, we've had people out in the community that we haven't even asked anything for that's brought us N95s. We did have Ford company who sent us 6,000 shields, face shields. So we have then now distributed them out to resources in the city, other places that need them. We've had people bring the big things, masks and N95s. People just bring them in. Here you go. Some people want to be acknowledged. Some people it's unknown from because they don't want that. But we've not really asked the community for anything. It's great. We have a wonderful public health PIO that she is out there. She's educating our community. She puts things on her website to get that stuff out. We try to keep updates on our website as to what's going on, how to do things. Public health plays a big role in this and has done wonderful and awesome job. So our community's there. If we ever had a call for something, they'd be here for us in a heartbeat. We're trying to continue on. We also, our facility has a hyperbaric chamber here, and we're one of the few facilities that have a hyperbaric chamber between here in Denver and here in Hays, Kansas. So we've continued to treat our patients that have needed to utilize that so we don't have a break in their care, and been able to continue on with their care. And they have been absolutely awesome. We have, of course, a different process. They know the process. They come in, they do their stuff. So it's been great to be able to provide that service for them. And everybody's been supportive in us continuing that, to include public health and the whole community. And like I said, the community will be there for us if we ever ask. I know they'll come through.
What surprised you the most in all of this?
How I really am unsure how to answer that. My first thing, once they come out and say, this is something I thought I would watch on TV and never see in my life, and how unprepared myself was to even try to get my hands around how lethal and deadly this is, and how we can, one day you can burn up so many resources that you thought you had enough and you don't. And how, where we're a small community, everyone in this community is going to be affected, because we're already starting to see cases that's infecting our family or our friends or a friend of a friend or a friend of a coworker. I just don't even really know how to answer. It's just, there's so many unknowns out there, and that's what scares me about phase one. You know, you're telling me that I don't, when I go to do my elective procedures, you can't even give me a straight answer as to, do I need to change my filter on my suction machines where I'm sucking fluid? Do I need to change my filter that I don't change every time? I mean, there's so many unknowns, and they don't know. We're doing phase one, not even knowing what an effect is going to be and what's going to happen. I think that's my most surprising thing, is how do we continue to go on with all the unknowns? We don't know if there's going to be a phase two. We don't know how the effect of COVID is going to be on the health of these people who have it. We don't know. I think that's my biggest thing, is the unknowns, because I'm a very big person on everything's black and white. It's, you do this or you don't do that, or you do this and you don't do that. So it's been very challenging for me on that. And it's probably something I'm still having a hard time getting my hands around. What do you do, and what's going to be for the best of the patient? And we try to always keep the patient at the forefront, which we always do, but what are we doing? Are what we're doing is doing the right thing? I just have to question that. I'm always questioning myself, because even CDC can't tell us. The government can't tell us. No one knows. No one's been through it. No one's encountered it.
Where are you getting your most reliable information or the information that's most pertinent to your facility? Where's that coming from?
The biggest resource that we use right now is we use CDPHE, and of course our infection prevention uses CDC guidelines. With me being the surgical piece that I also rely on all the ARN guidelines, SGNA guidelines, make for sure that our anesthesia staff, we have 24/7 anesthesia staff here. I make for sure they utilize their societies and resources. We bring them all back together. But for the most part, our governing bodies, CDPHE and CDC, I feel that they're the most reliable. What CDC says is what we need to do. And those are the regulations and recommendations that we do follow. As far as anything that we've implemented, we try to implement other things. I mean, I feel like our policy on COVID infected patients with our surgical has been a group of, our primary has been CDC. We've used the AHA, CHA, but our big one's CDC that we've used to get through that. We've also implemented it within that some of our anesthesia society guidelines for our innovation practices. So if I had to pick one, it would be CDC and CDPHE, I guess, are our two main resources. That's where we do all of our reporting out of too, is CDPHE. And then within our facility, we monitor just with what we know we've done, and that's what we report out daily to our board of directors.
You are geographically isolated from the metropolitan area. Do you feel even more isolated from the metropolitan area now than you did before? Or are you more connected?
I feel like we're probably more connected. Our interim CNO right now, they reached out to a facility in Denver, and we were in need of extra large gowns. They automatically, boom, they have us 2 cases we should be getting today. They've also been the ones who's reached out to us. They came back to us and said, look, we're getting UV light. Here's the criteria. Here's the guidelines. If you're interested in reprocessing of your N95s, here's what you need to do. Here's how to do it. So I really feel like we're probably more connected. We're probably getting a stronger bond with Denver because they're reaching out to us. We're reaching out to them. And I think it's a stronger bond. I don't feel that we've had lack in support where we're level 4 and we're 168 miles from a level 1. They've been great. We've not had a problem with flights getting out of here to get our people flighted out. We haven't had problems in transferring ground transfers. We've had no issues there. If any of our staff have needed to connect with Denver for anything or a consult, it's worked very well. So I feel like that bond's probably going to get better better than what we even had with them before. We're going to come out of it with a better bond.
What do you want the future to remember and to know about this experience?
That's hard for me to answer because I don't know that I want to remember much about COVID. The only reason the only thing is that I can say is that just always remember your frontline workers, what they're doing, what they got to go through. I think that people do not understand. It used to be you came in the ER, the nurse seen you, got evaluated. There's no idea everything they got to go through, the resources they got to garb up to, the cost of the expenses for them to garb up, everybody in the room to garb up, put on their PPE, evaluate the patient, all the precautions that are taken, all the regulations that are done, let alone what those frontline workers are doing. it just amazes me. I guess if there's anything I want them to remember is remember those frontline workers. They're dedicated people. They're here. They're putting their lives on the line, and not only their lives, but they go home to their family with the potential of every day knowing that they can expose every one of their loved ones as they're around. That I just can't say enough about our frontline workers all over the world, not just in our little facility, but all over the world. They're hardworking people.
As well as you. And you're
Thank
coming
you.
to work. And how do you decompress? I mean, how do you get up every day wondering how many challenges I'm going to have today? What skills are you using or relying on?
Well, it's been difficult because there's really no de-stress at times. I mean, there's just, I wake up, as I grab my computer, I've got 55 things I got to get done, and you start going on it. I probably ran for 10 days on nothing but full dedication, and then realized I got to decompress. So I use that. My husband and I are awesome team. The best thing of all is we have a business. And so to get started back in that business, it's a seasonal business. To get started back in that business has been my decompress. Like right now, my big thing's going to be my gardening. I love to garden. I'm a big gardener. So my plans are this afternoon, if it all works out, is to go home and start getting my garden planted. That's my big thing. I mean, I haven't done it, and it's very difficult to decompress or even let go when you know, I gotta. You gotta be strong for the rest of the people in this hospital. And I feel like I got an obligation to them for all the years that I've been here. We don't have a lot of longevity right now with our employees in our hospital. So they're like new employees, or they may be 5-year or 7-year employees. So some of them have never been through a type of emergency preparedness to even go through this. So you just got to be strong. I mean, you can't worry about whether you decompress or you do things. You got to be strong for them. And maybe that's the way I'm decompressing, is through them, because we do have a lot of heart-to-hearts. I have a lot of heart-to-hearts with my staff, and that's probably how I've decompressed the most. But I'm looking forward to today, start my garden.
Good. Well, I'm glad to hear that you're taking care of you in all of this, because
Absolutely.
you play such a vital role in keeping all the parts and pieces together. And certainly thank you for that, and all the hard work you're doing in the community. And is there anything else that you want to share about this experience? Lessons learned, or things about yourself that you're surprised that that's how you feel about certain things? What's the message you want to leave?
I guess if I had to say one thing, it would be, don't underestimate the unknown. A lot of times I think, especially in healthcare, we take things for granted. Sometimes we feel like it never happened to us, or things will just go on. I don't know. I have a lot of, I don't even know if I can really answer that question other than that. Don't underestimate the unknown. It's just been a challenge to me through this whole thing, but I'm so proud of our little hospital and the way all the staff has pulled together. I have not had one person that I've asked to do one thing that's ever denied me. And it's just great that we're all pulling together and we're all here for each other. We're kind of like a little family within a community, and it's just been great. I mean, I just don't think we can ask for better staff, better doctors. Our docs have been awesome. Our whole medical team, our our PAs, our nurse practitioners. It's just unbelievable. It's just hard to answer a lot about COVID right now. I mean, I think in my world, I'm so frustrated at the unknown that it's going to be interesting of how I feel in 6 months about this. I think I'll even learn more than what I learn now. But I've learned a lot about how you got to really trust in people. You got to be prepared. And if there's one thing I can tell rural hospitals, practice your emergency preparedness. Everybody plays a role. Everybody plays a very important role. And if your people do not know what to do, it's an added burden to your facility. We've been very blessed here. We have a lot of new people in ICS, but for the most part, we have some very, very strong people in ICS. Matter of fact, one of our board members is a big ICS guru, so that has also been a big asset. We do ICS meetings every morning. We have a group. We have group meetings. We have furlough committees. I mean, it's great how we've committed everything together, and we put the key players in those groups to make things work. And that's what you got to do in a little small place, but just never underestimate the unknown.